Okay, welcome to the last chapter that we are going to cover in the textbook, which is family systems therapy. So, when you hear the term family systems, it is an umbrella term, meaning that there are many types of family therapies that are out there. And so, we're not really going to get into the different types of family therapy, but we're just going to talk about its significance. Up until this point, we have mainly dealt with therapies that look at the individual, looking at the individual psychology, looking at mental frameworks for understanding the individual, but we haven't really looked at anything that helps us to understand the family. So if anyone here is thinking about being, a couples counselor, if anybody here is thinking about working with children, well, just know that when you're working with children, if they're under the age of 18, you're going to be working with families. If you're going to be working in addictions treatment, you're also going to want to be able to understand family dynamics because that's going to be really crucial in terms of helping the person go back home and have a better chance at keeping their recovery. So those are some of the ways that you may come to understand family systems. I personally have mostly worked with individuals, but every once in a while, I've had to do some work with families, but my primary understanding of working with people is more on the individual spectrum. So the big idea, the big radical idea with when family systems therapy gets developed is that basically when psychology happens, it's only looking at the individual. So from like 1886 to the 1950s, the individual is an island, and what happens to the we're only dealing with the individual themselves. And what a lot of people noticed, especially if they were working in some of the psychiatric hospitals, is they would have a patient that would come in to the hospital. They would work with them to help them with their symptoms, and they would send them home. And once they got home, they would end up relapsing, and then would have to come back to the hospital with their having a full-blown depression, anxiety, or whatever it was. And so they started thinking like, maybe the environment, the family environment is impacting this person. Maybe there is, we have to look at this a little bit differently and not always just treat the individual. Perhaps we have to also work with families as well. And so they start doing some of that work of creating family systems work. And so that starts in the 1950s. So we start looking at, instead of treating the individual as an island, we start looking at how the family environment can impact the individual. So when you're doing family therapy, there are some assumptions. And so here are some of the things a family therapist might assume about a client's problematic behavior. They might assume that the client's behavior serves a function or purpose in the family. So you could have a someone in the family who is the sick one, and the whole family organizes around taking care of the sick one in the family. There's many other dynamics that are out there, but that's just one example. Um, you would assume that the client's problematic behavior may be unintentionally maintained by the family process. You see that a lot of times with addiction um, uh, uh, treatment when the person who comes in for addiction treatment goes back home. They could be more of a the family hasn't changed enough and may do things like I remember one particular incident where the person went into came home from addiction treatment, and at first they were relieved, but then now the husband is home and he is sober. And so the wife buys beer and puts it in the refrigerator so that he'll get out from underfoot because she didn't have the skills to deal with this new version of her partner. So they could unintentionally maintain a family process. It might be a function of the family's inability to operate productively, especially during developmental transitions. It could be a symptom of dysfunctional patterns handed down across generations. And all these assumptions challenge the more traditional framework of blaming an individual instead of seeing it as a relational view. So oftentimes when a family comes to therapy, they have the identified patient. And so they will say all the problems are because of this one person. So we're going to look at a couple of scenarios about this and talk about who the identified patient is. So we have a family system of five. That family includes a mother, a grandmother, and three children. They come to therapy because the youngest child is misbehaving at school and acting aggressively towards both symptoms. So, who does the family identify as the patient? In this instance, they identify the young child as the patient. But as we've probably seen in other classes, why is the young child misbehaving? Where is the father? Has there been a recent divorce? What is happening where the child may be misbehaving in this? So it's going to look at it from a systems perspective. Um, a family system of four. You have a mother, father, and two daughters who have come to therapy because of the father's drinking. The children side with the mother. So who's the identified patient? In that instance, it is the father is the identified patient. A family system of three. You have two moms and their son have come to therapy because one of the parents is working too much and is never around. So who is the identified patient? It is one of the mothers that is showing tendencies to being a workaholic. And when you have a family system of two, you have a couple comes to therapy because one person had an affair with a coworker. Who is the identified patient? It is the person who had the affair. So these are the things that will often happen in family systems that one person is causing the problems. And when you're a family systems person, you don't see the identified patient as the problem. You see it as the entire family is the patient, not just the one that they say, fix this person. A family systems therapist would not fix the one person. They would focus on working with the entire family system. So if we're going to just look at and try to understand how an individual therapist who gets training in individual therapy versus a family systems therapist and their training, how they would treat a client. I think that's a great way of understanding the difference between the training. So if you can get trained if you do the counseling track at Rick or the social work track at Rick, you can get trained in just working with individuals. There's an LMFT track, Licensed Marriage and Family at URI, and you get trained heavily in family systems. It doesn't mean that you can't take courses at at Rick that are about family, but if you do the LMFT track, that's all your courses are. All your courses are about working with family systems, working versus working with the individual. So they're going to have very different approaches when someone comes in. So here's a person who comes in. Her name is Anne. She's 25 years old and she's seeking counseling because she's suffering from depression that has lasted for more than 2 years and has impaired her ability to maintain friendships and work productively. She wants to feel better, but she is pessimistic about her chances. So we're going to look at the similarities and differences, how someone who is an LMHC got trained in individual therapy versus an LMFT who got trained in family systems therapy, how they would handle it differently. But first, we'll start with the similarities. So during the assessment, both the licensed mental health, the LMHC, and the licensed marriage and family are interested in Anne's current living situation and life experiences. They both discover that she is still at home with her parents who are in their 60s. They note that she has a very successful older sister who is a prominent lawyer in a small town to which the two live. The therapist recognizes Anne's uh, is impacted by a loss of friends who have married and left town over the years while she stayed behind, often lonely and isolated. And then finally, both therapists note that Anne's depression impacts others as well as herself. They notice in the assessment process, they notice similar things. But here are the differences. The individual therapist is going to focus on obtaining an accurate diagnosis, probably using the DSM. Begin therapy with Anne immediately, focus on cause, purpose, cognitive, emotional, and behavioral patterns involved in Anne's depression and coping, concern with Anne's individual experiences and perspectives, and intervene in ways designed to help and cope. So that's what an individual therapist is going to be trained to be focused on. But a family systems therapist is going to be looking at the entire family. So they're going to explore the family system, such as who gets along and who doesn't, what are the formal and informal family rules. They might even use a genogram, which we'll talk about a little later. They're going to invite Anne's mother, father, and sister into therapy with her. So notice the individual therapist is just working with Anne and not inviting anyone in, but the family systems therapist is going to say, there are people who are impacted by your depression, your parents and your sister. Let's get them into session with you. They're going to focus on family relationships to assess if they are contributing or maintaining Anne's depression. They're going to be concerned with transgenerational meanings, rules, and cultural and gender perspectives within the system, and even in the community and larger systems affecting the family. They're going to intervene in ways to help change Anne's context. So, very different approaches when it comes to that. In terms of the development of family therapy, it had a lot of influences. So in the 20s, there was a marriage counseling movement that was usually done by clergy, lawyers, divorce lawyers, sometimes social workers, even sometimes medical doctors. So there was like a marriage counseling movement that influenced family systems therapy. We know that there also in the 20s and 30s, there was the child guidance movement. Adler did that. Was a big proponent of that. In the 40s and 50s, there were these theories on cybernetics, which they used a metaphor of family as a machine, systems and communication theory, and also influenced by theories from anthropology, sociology, and biology. And then by time the 60s rolls around, family systems therapy becomes a distinct practice. They postulated that disorders were due to troubled family relationships, not because of personal deficiencies. In fact, one of the more unpleasant things that came out of the family systems therapy is when it came to schizophrenia, they were actually trying to blame the mothers for that. They would call them like refrigerator mothers. They noticed that like the moms were cold and detached and aloof, and that type of mothering caused schizophrenia, which has been completely disproven and it is no longer true. But unfortunately, that was one of the bad things that came out of the family systems movement. In the 70s, they developed clinical methods to treat troubled families. And in the 80s, they started using some postmodern approaches like narrative family or even feminist theory to look at family roles a little bit more, which we weren't able to cover in this class because of it being so condensed. But they are in your textbook if you do want to read about them a little bit more. Classic family therapy is Bowen's Family Systems. There's a video this week that you can watch from the 1940s on his theory, though Murray Brown. Then you have uh, experiential family therapy and human validation model. That was Virginia Satir. She created that in the 1950s. Her discipline was social work. And then we also have structural family therapy in the 60s. Founder was Salvador Minuchin, and he was a psychiatrist. So those are kind of like the three classic family therapies, but there are a lot more. In terms of the postmodern family therapies of the 70s and 80s, you have the narrative approach, which is Michael White and David Epstein Epstein, and that was they were in I believe Australia. You have collaborative approach by Harleen Anderson. You have solution focus with Inso Kim Berg and her husband Steve DeShazer. And the feminists, Miriam Waters, Betty Carter, Peggy Papin, Ogla Sill. Um, uh, oops, oh, whoa, and then sorry about that. And then you have postmodern family therapy also talks about the client being the expert, therapist is the guide. They consider how dominant culture, religion impact family systems. So that's kind of what the postmodern uh, therapist family therapists focus on. In terms of, even though they have all these different types, and there's even more than what I'm showing you now, even though there's all these different types of family therapy, there's a lot of commonalities between them. So they see a family as a system. The behaviors and emotions of one member affect and are affected by others. They focus on improving communication. They focus on intergenerational influences and address dysfunctional patterns. They focus on changing patterns of interactions. So families learn to set healthier boundaries with each other. Um, and the therapist's role is to be, as best they can, a neutral facilitator. So avoid taking sides, helping families to understand dynamics and find solutions. So a family therapist, and similar to a marriage counselor, is supposed to be neutral and not take sides, and recognizing that there are many, that it's a dynamic system and that each person plays their part with it. As I mentioned, family therapy therapists love genograms. So there's a lot of different type of genograms. You might have even had to do some of those in some of your other classes. But here's just a key in terms of like when you're trying to look at a genogram in terms of like recognizing what a square is and what a circle is and what a triangle is and what a straight line is versus a dotted line versus arrows versus squiggly lines. They all mean different things, and it's how the therapist will start to map out at least the goal with family therapy is at least three generations of of the family to see how some of these patterns are being passed down. And so it's a visual style of looking at it. So here's an example. We have Frank over here. He's 62 years old. He's married to Kathy, who is 60. And you see kind of like that squiggly line, which if we look at the key, that squiggly line means that it's hostile and then it's got an arrow on it. So that means that Kathy is angry at Frank. You'll also see in terms of the three generations, you'll see the children that they had below them, and then the parents that they came from, as well as the type of relationship that they have. So you'll see Frank has a close relationship with his mother. He's in a caretaker role to looks like his sister, I'm assuming, that's in there, and he has a distant relationship with his father. Um, so that's how a genogram looks. It's trying to capture in like one shot three generations of what's happening in a family and understanding their relationships and trying to see if there are patterns that are being like repeated. Family therapy characteristics. It tends to be short term. Average number of sessions is about 12. Some of the issues that could be brought to family therapy are family stress and conflict, mental health or addictions, parenting concerns, communication problems, improving parent-child relationships, sibling aggression, step family, trying to blend families together. Could maybe even be premarital counseling or divorce or separation. Those are some of the issues that people might bring into a family counseling. In terms of the contributions, one of the most important contributions, and if you remember nothing else about family therapy, is that the individual is best understood in the context of the family. And I think you can even use this if you go outside of the family. So, my work that I did working in EAPs, we would not necessarily deal with family systems, but we would deal with work systems. And so, oftentimes you would have, say, coworkers that aren't getting along with each other, and would see how that impacts the work dynamics. That would be something that we would have to pay attention to. how is it impacting their supervisors? How is it impacting their other coworkers? And try to look at it in terms of like understanding work behavior in the context of the work environment. So not exactly family systems, but still using a systems approach to understand what's happening in the workspace. It helps the therapist avoid scapegoating an individual as the bad person or identified patient. So prior to that, there could have been buy-in that this person is the sick one or the bad person, and they're causing all the problems in the family. But what family therapists learned is that when they work on if they did buy into that and fix the bad person, then all of a sudden they would start having the problem would just shift and show up in somebody else in the family, and then that would start causing dysfunctional dynamics. So that was part of the reasons why family therapy has tried to avoid scapegoating. Even though the family might try to scapegoat one person in the family, the family therapist is aware that, well, if you fix that bad person, it's just going to show up somewhere else. Um, Emphasize on the importance of improving communication skills. So if you've ever, heard people talking about communication, I need better communication skills. You'll hear that a lot in couples therapy. That came out of the idea of improving communication, came out of the work of family systems. Um, I don't also recognize that families have values or even rules, and I've heard this talked about when they talk about foster care, when kids are in foster care, and if they go from house to house to house, that every house they go into has different rules, and when the child is trying to like understand the damn different rules, because oftentimes those rules are, some of them are overt, but some of them are invisible, and you don't know you've crossed the rule or made someone upset until you do the thing, and how that can be really stressful for kids in foster care. So it talks about emphasizing values or those rules, written or unwritten rules in family systems. In terms of its limitations, they recognize there's an overemphasis on the family system and can minimize the needs of an individual. It assumes all family members are willing to participate, and oftentimes they are not. There can be members of the family that will sabotage therapy or even refuse to come. So that's something that the therapist has to assess for as well. And the family system models may not always account for non-traditional family structures, like LGBTQ families or single parent families. No matter what you do, there's always going to be a bias. So even though the therapist is supposed to be neutral, they may it may be difficult for them to do that. And one of the biggest things is health insurance is that we have. If you're Blue Cross, your Blue Cross, your United Healthcare. It is geared towards an individual, so it can be challenging to get family therapy paid for by private insurance. And there are some states that will not even um, look at family therapy or couples counseling. They'll say, yeah, if you want to do that, you have to pay for that in cash because some states, their regulations are so strict around that if the um, therapist, if the billing company gets wind that there's somebody else there, that they could just deny the billing. So typically, this is like a little inside baseball, but typically, if a client comes in, you have the primary client with their primary insurance, and then you would bill the session as plus one, or if you had like couple of other people coming like, plus two or plus three. But you're not going to get paid more because there's more clients there. You're going to still get paid, say it's $100 an hour. Doesn't matter if there's five people in there or, one person in there, you're still only going to get reimbursed for the $100 or whatever that rate is. So there's some issues and inequities with how this is paid or if insurance will cover it. If you are interested in family work, URI has a great program. You can get your Bachelor's of Science in Human Development in Family Sciences and get a master's in Couples and Family Counseling. They also have the building that you see there is the URI's Couples and Family Therapy Clinic, where interns will work with like teams to learn how to work effectively with families as well. And it is, I don't know what the rate is now, but I think it used to be like 25 or $50 um, an hour to get therapy there for people in the community. Um, and then if you're also interested in learning more about the families on YouTube, there is a website by a licensed marriage family therapist, Stefania. She has a whole series with short videos describing at least a dozen different types of family therapy models, and she does a really great job of talking about the different family mo therapy models that are out there. So if you are interested in that, that's a resource for you. And that is it. So, over the course of the semester, we have talked about the basic skills in chapter two of what you need if you're going to work with people. In chapter three, we talked about the ethical concerns that you need to be aware of, and then from there on out, we started talking about the different frameworks that you can use in terms of trying to understand people and their behaviors and using the different mental frameworks. Oftentimes, most people end up using a couple in terms of trying to understand, but you tend to use the ones that resonate with you most. So whatever those are, could be person-centered, existential, could be Adler, could be family systems. But people tend to have like a couple that they gravitate towards in terms of trying to like understand things. And if this was a grad school course, your final paper would actually be picking those models that resonate with you and which models you plan to use if you become a therapist. But since we are just introducing you to them in terms of how you might use them as a case manager, we don't get into that. But if you do go on to grad school, you might be writing that paper or doing a presentation on that as well. All right, so hope that you have a better understanding of working therapeutic interventions and working with individuals. And I wish you well. Take care. Bye.